Welcome everybody, I'm Lauren Klump with Spine Rehab, and today we're having a really short, informal discussion about cupping therapy. The coverage of the Rio Olympic Games, specifically, our swimmers made cupping therapy kind of famous with Michael Phelps, but we've actually been using this as a treatment for many years at Spine Rehab, and today Dr. Sarah Corcoran is going to be walking us through what cupping therapy is and how she uses that to successfully treat her patients. So thank you so much, Dr. Sarah. I'm going to go off webcam now so you can share your screen.
Okay, perfect. Hi everyone, I'm Dr. Sarah Corcoran. I'll be talking to you all about cupping. Let me just pull up our presentation here. Alrighty. So we're going to be talking about cupping therapy for muscle recovery. As Lauren introduced, it has actually been around a long time, so even longer than we've been using it in sport and spine. It's been around for about 3,000 years. It originally came from Eastern medicine. Similar to acupuncture, it originally started along energy meridian lines, focusing on specific sites of blockage of blood or energy stagnation. So in the Western medicine world, we saw dry needling actually come and stem off from acupuncture, specifically looking at areas of muscle hypertonicity or trigger points. And that's what we'll be talking about today with cupping, specifically areas of muscle tightness rather than along meridian lines. So as most of our patients have muscular imbalances, muscle tightness, cupping can be used in a wide variety of fields. So chiropractic, physical therapy, massage therapy can all use cupping, which is one of the reasons why I really like it. As Lauren mentioned, it was kind of brought to light in Rio through the use of swimmers, gymnasts, all sorts of athletes. So today we'll be talking about how cupping is used and why athletes like it so much.
Great, thanks for that intro, Dr. Corcoran. For all other participants, if you don't mind muting yourself while you're not speaking, that will help us to get a better sound quality. Thanks.
Thanks, Lauren. So here's a picture of Michael Phelps actually being worked on with the suction technique. So this is what we use in our office. We use a vacuum and with our cups. So this suction actually creates a lack of oxygen within the cup. It creates a negative pressure which lifts the skin off of the fascia and underlying tissues. So this draws blood to the area and increases oxygenation and improves circulation and the movement of lymph flow. Another reason why cupping is great is because it actually stretches the underlying fascia. So this is important for athletes, people with abnormal posture, patients who've just gone through a motor vehicle accident and have spasm muscles. It can help everyone. So while we are focusing on athletes today, we do use it on a variety of patients in our clinics. One of the downsides of cupping is the circular bruising that can happen. This is just due to the breakage of some small blood vessels. The extent of the bruising depends on how long we leave the cups on and additionally how tight the muscle was to begin with. And if anyone has any questions at any time, please feel free to jump in. I forgot to say that at the beginning. So why do we use cupping? We already use instrument-assisted soft tissue mobilization in our clinic, or Graston, the top picture that we see here. We also use myofascial release technique with our hands. So you might ask why cupping? It's just another tool in our toolbox. It's also a little bit different from those two types of techniques that I mentioned. It is decompressive rather than compressive. So when we're using an instrument or our hands to dig into the actual tissue, with cupping we are pulling the skin up, creating more space for new blood, new oxygen to come through. So it's a little bit different in that way, just to improve oxygenation of the tissues. As you can see in the bottom picture here, cupping can also use heat to create that negative pressure. So with the flame here, practitioners will use glass cups and put a flaming cotton ball inside the cup. When that flame goes out, the drop in temperature creates the negative pressure, pulling the skin up. With these cups as well, many people will move them around the tissues, around the body, just creating extra stretch in the fascia. Additionally, patients will go through dynamic motions with the affected limb or movements in the spine to get a better impact or a better stretch. Currently, the cups that I'm using are just these vacuum cups, and we don't use any skin lubricant, so it's just a passive technique. The patient's relaxed, but I would like to look more into the movement aspect of cupping as well. Okay, so moving on to why athletes are using it. One of the main reasons I think that it's become pretty mainstream in athletics is the fact that it is very quick and effective. So when patients or athletes are having multiple practices a day in the Olympics, many meets or events, in a short amount of time, they need something fast and effective. The cups are left on the skin for about 5 to 10 minutes, and very quick turnaround here. Most of the patients that I've used this on, including myself when I've had it done on myself, it's very quick to get a great result. So patients will say they feel looser, have greater range of motion, just a lot of tension is released. So I've had very good results with that. Again, one of the side effects is bruising, as we can see in this picture with Michael Phelps. This can be a good and a bad thing. So when I've had cupping done on my posterior shoulder musculature, when I've gone out, it's actually been a great thing to spark conversation. So I've had people come up and ask me about it. So it's been a source of patient education. So I think just letting patients know that there will be bruising, and if they're okay with that, then we can go ahead and try the therapy. But it's a great tool. As like any therapy, there are contraindications. We want to make sure we're aware of these before we start using the technique. So any patients with heart failure, kidney failure, bleeding disorders, we don't want to use cupping. Additionally, if people have sensitive skin or skin conditions, we want to be aware of this. If patients have eczema, we don't want to use it during acute flare-ups. Additionally, with inflamed skin such as sunburn, we want to be very careful about that and not use cupping. One of the other downsides of cupping right now, as it is an Eastern medicine technique originally, there isn't a lot of research. So we do not know the effects of cupping on pregnancy. So for that, I would err on the side of caution and list it as a contraindication just because we're not sure of the effects in that respect. Alrighty, now we are going to move on to our live demonstration. As we can see here in a little bit more of a closer view, here are the cups that were placed on rhomboid musculature, upper trap, and some posterior shoulder musculature. You can see that the skin is lifted up into the cup, creating that suction, and the blood flow is permeating the area, creating the dark red color. The cups were left on for about 8 minutes here, and you can see that the center cup is the darkest with the most bruising. That was actually the area of the greatest hypertonicity as well. Let me just grab our simulated patient here, and we'll get started with the live presentation. Okay, I'm going to exit this PowerPoint here.
Dr. Corcoran, a lot of folks have asked me, what does it feel like when you're having the treatment done?
Yes. So mostly it's a sort of pulling sensation on the skin, a little bit of tension. When I ask people as we're going through it if there's any pain, most people say no. I haven't felt any pain. Some people feel more tightness than others, depending on the sensitivity of the skin, the tightness of the area, and just their own personal preference. Great. Okay. You want to just go ahead and have a seat here? All right. So first thing we want to do is find our areas of hypertonicity. In practice, I see a lot of upper trap, levator scap, and posterior shoulder. So we're going to go ahead and feel here. Definitely some upper trap tightness here. So again, as I described, we're just going to take this cup, and here is the vacuum suction. Just so everyone can see it a little bit more clearly, it's very simple. We just put the suction on like this and do a few pumps like that. So I'm just going to go ahead and feel this here, and here. Awesome, and take it off here. How's that feeling so far?
Good.
Awesome. So as I said prior, this is left on for about 5 to 10 minutes. Really depending on the color of the outside. If it's getting purple, I always take it off. If the area may be profusing more with blood earlier on, then I will take it off earlier as well. I always stay with patients during this, so if there are times of discomfort and we have to take it off, we will. But that doesn't happen very often. Most people find it relaxing. So. At this time, as we're leaving the cups on, if anyone has any questions, please feel free to ask them.
Sarah, can you put it over a joint, like say in front of the knee?
So I would not actually put it over a bony protuberance. One of the reasons that this is important as well is that the cups usually don't stick. So it's normally with fleshy areas. So if it's a little bit too bony, the cups are not able to get adhesed to the skin. But that's a great question. Thank you.
Dr. Corcoran, what are some of the other treatment modalities that you most commonly pair with this as part of the patient's treatment plan?
I will definitely still do manipulation to work on the joints themselves. Additionally, instrument-assisted soft tissue mobilization has been great. So a lot of patients actually will request for cupping and instrument-assisted. Some will get enough relief with cupping that they feel great, and that's it. So it really depends on patient preference, but both of them are achieving similar results, so creating low level of inflammation to stimulate healing. Another great question. Thanks, Lauren.
Sure.
I usually leave at least an inch between the cups, otherwise the skin just gets too tight. There's too much tension in a small region. So right now we're just doing a bit of upper trap and posterior shoulder. And we will leave these on for about 5 minutes. Awesome. I'm always going to keep looking. The area around the outside of the cup will get darkest most quickly. So I want to make sure if that gets to a dark red or a dark purple, then we take the cups off.
Does the patient usually feel relief right away, or does it take a couple of days?
Normally right away. So this is something that I've really liked, just especially on patients if they are very acute, patients who come in from car accidents that are tender to palpation right on a muscle, and they have been able to tolerate the cupping, and then they're able to actually have greater range of motion right away. So it's great having people come in very acute, spasmed, and not that it's a be-all, end-all, will work all the time, but the patients I have worked with really do see great results in a quick amount of time, and are actually pretty lasting. So I've been following up with patients and seeing if it lasted, and it will get tighter again, naturally, as with other manual therapies as well. It does take a little bit of time and healing, but I do like the effectiveness and speed of the feeling of a change, definitely. All right, so as we're looking here, this is actually getting pretty dark on the outside, so I'm going to go ahead and take them off here. To take them off, we actually just grab the middle portion. So I'll go ahead and just show everyone in a cup like this. We just pull up on the middle to take it off. Most patients just feel a bit of relief at that as well. All right, great. I'll go ahead and just move this a little bit closer just so everyone can see. A little blurry, but so there we have some slight bruising. Again, fairly normal. Bruising, depending on how bad it is, will go away in a few days, up to a week. So, yes. Anyone have any other questions?
Would you ever use it in an athlete, let's say an athlete that has a pulled hamstring, after the acute phase, when there's maybe some scar tissue forming a week after the injury? Was that a good indication?
Definitely, because it helps pull up the skin from the fascia and stretch the fascia. I think that's a great use. Just decrease the fibrosis, the buildup of scar tissue, and to stimulate the new blood and lymph flow for healing. So definitely.
Would you ever do Graston and cupping in the same time, or do they kind of contradict each other?
So when you say same time, is it when the cups are on the skin doing Graston around the cups, or just in the same treatment?
Same treatment.
Yes, definitely. I do that. I will usually do cupping first and then do Graston somewhat around the areas just because they're a little bit inflamed where the cups already were. But just to get to the areas in between them, I will do that, and patients really like that combination as well.
Gotcha.
Yeah. Great question, Dr. Thank you.
Great, thank you so much. Any other questions, folks?
I don't know of any other practitioners in the area doing this besides you.
I don't know any. I know we've been doing it for a while. I just like how it's easy. It's easy on the provider. I know a lot of chiropractors, physical therapists, they're using their hands all day, massage therapists using their thumbs. It's a great way to achieve soft tissue techniques without that pressure on your own joints as well, and patients get amazing relief. So I think so many people should be doing it. I'm glad that it got brought to light with the Olympics and got a little bit more press because it deserves it.
Yeah, I know that some of our other practitioners are doing it at a few of the other sport and spine rehab locations. But yeah, I can't think of anyone else. I know from personal experience as an ultra-marathon or a marathon coach, I first had the treatment about 3 or 4 years ago, and I've tried just about everything in terms of recovery, and I noticed a huge response from it in my own training. So yeah.
Yeah, definitely. It's great.
Well, I want to thank everyone so much for joining us today. We are going to send a follow-up email. If you have additional questions or would prefer more of a live demonstration at your office, we'd be happy to set that up with you. So we'll post information on how to do that. Thank you so much, Dr. Corcoran, for an amazing presentation.
Thank you, Lauren. Really appreciate it. Thank you for everyone for coming. Thank you, Dr. Anders, for all the great questions. Appreciate it.
You bet, you bet. And you're only at the Rockville office?
Yes.
Okay.
Yes.
Excellent. Thank you.
Awesome. Thank you. Thank you all. Have a great day.
Bye.
Bye.